Welcome to our deep dive into the fascinating world of coronary circulation. We're delighted to have you with us on this educational expedition. Today we're privileged to have an esteemed panel with us comprising a seasoned cardiologist, an inquisitive medical student, and a patient who has graciously agreed to share their personal experiences. The cardiologist will guide us through the intricate labyrinth of coronary circulation, shedding light on the vital role of the right and left coronary arteries. Our medical student is here to ask all the complex questions that might pop into your head, ensuring we leave no stone unturned. And lastly, our patient will provide a unique perspective, grounding our exploration in the lived experience of people who navigate the world with heart conditions. So, buckle up as we embark on this remarkable journey to comprehend the highways and byways of the heart. Let's dive right into the fascinating world of coronary circulation. Have you ever contemplated the mechanics of blood circulation within our heart? A complex network is at the helm, propelled by the wonder of coronary. This organ system is the linchpin of our heart's well-being and operation, a well-executed ensemble performance that guarantees the constant beat of life. At the center of this intricate system, and I assure you no jest is intended here, we have two principal entities, the right and left coronary arteries. These arteries, akin to major highways, spring from the base of the aorta, our body's most substantial artery. They branch out, supplying our heart muscle with the oxygen and nutrients imperative for its ceaseless, regardless of their names. The right and left coronary arteries do not hold any partiality. Each has a unique function, and they are both equally essential for the sustained balance of our heart's performance. Now that we've skimmed the surface, we can delve deeper into the particulars of this intriguing process. Fasten your seatbelts, and let's set off on this educational expedition through the heart's highways and byways. Starting with the right coronary artery, or RCA. This artery is a marvel of natural engineering, supplying blood to vital parts of the heart. Now let's meet the RCA's branches, each having a unique role in heart circulation. First, we have the acute marginal branches. These branches snake their way across the heart's surface, supplying blood to the right ventricle. With each heartbeat, they ensure this powerhouse of the heart stays well nourished and ready for action. Next, we meet the atrioventricular, or AV, nodal artery. This artery is the heart's own power line, ensuring the heart's electrical system, the AV node, receives the blood supply it needs to keep your heart beating synchronously. Finally, we have the posterior interventricular artery, also known as the posterior descending artery. This artery descends along the back of the heart, supplying blood to both ventricles and ensuring that the heart's lower chambers get the nourishment they need to pump blood powerfully and efficiently. The RCA and its branches work in harmony, each playing a crucial role in maintaining the heart's function. From the powerhouse ventricles to the heart's electrical system, the RCA ensures that every heartbeat is a symphony of perfectly coordinated movements. That sums up the journey of blood through the right coronary artery and its branches. Each branch, each artery, each heartbeat, all interwoven in the intricate dance that is the coronary circulation. Now, let's shift our focus to the left main coronary artery, or LCA. This is a major player in the coronary circulation, originating from the root of the aorta, just like its counterpart on the right. The LCA, however, bifurcates into two primary branches, the left anterior descending artery, or LAD, and the left circumflex artery, or LC. The LAD is often referred to as the widowmaker, because blockages here can have serious consequences. It runs down the front of the heart and supplies blood to the front and bottom of the left ventricle and the front of the septum. Off the LAD, we have diagonal branches and septal branches. The diagonal branches serve the side and front of the heart, while the septal branches dive deep into the heart muscle to supply the septum. Next, let's talk about the left circumflex artery, or LC. This artery curves around the left side and back of the heart, supplying blood to the left atrium and the back of the left ventricle. From the LC, we get the obtuse marginal branches, which provide additional blood supply to the outer side and back of the heart. Together, these arteries and their branches weave a complex network, ensuring every part of the heart receives the blood it needs to keep pumping. Each branch plays a crucial role, highlighting the intricate interconnectedness that enables our hearts to function so effectively. So that's how blood travels through the left main coronary artery and its branches. But how does dominance in circulation work? Now let's dive deep into this fascinating concept. Dominance in circulation refers to the artery that gives rise to the posterior interventricular artery, and at least one posterolateral branch. Now imagine this. In about 80% of people, this dominance is right-sided. Yes, you heard that right. The right coronary artery reigns supreme in the majority of us. But hold on, it's not the same for everyone. About 15% of us march to the beat of a different drum, having a left-dominant circulation. This means in these individuals, it's the left circumflex artery that takes the lead. The responsibility of supplying the posteroinferior left ventricle. Dominance in circulation is a crucial part of how blood travels in our heart. And what about the sinoatrial node and venous drainage? Good question. The sinoatrial node, often called the heart's natural pacemaker, is supplied by the sinoatrial nodal artery. Now, this artery can sprout from either the right or left coronary artery. This session on coronary circulation, I want to emphasize one crucial point. Although understanding the general principles of coronary circulation is vital, remember that each person's case can be different. What we've discussed today is a broad overview, but your individual coronary circulation could vary. For example, some people may have an additional artery, or one of their arteries could take a slightly different path. That's why it's crucial to consult with your own cardiologist or healthcare provider who can help you understand your unique heart's anatomy and function. They can provide you with personalized medical advice based on your specific condition and history. So, while learning about coronary circulation is a great first step towards understanding heart health, always remember to consult with a professional for a more personalized picture. Keep this in mind as we continue to explore the fascinating world of human anatomy. Remember, your health is your responsibility, so take good care of your heart, and it will take good care of you.